Medicare Advantage plans offer the convenience of bundling all your healthcare coverage into one plan. A trade-off for the convenience of a bundled plan is generally a limited network of hospitals and doctors you can receive care from. Medicare Advantage plans are private insurance alternatives for Medicare coverage. All Medicare Advantage plans cover Parts A and B. Most include prescription coverage. Some Medicare Advantage plans cover dental, vision, hearing, or wellness checks. Medicare Advantage premiums often look lower on a monthly basis, but it's important to investigate the cost-sharing structure of these plans. You need to look at what you will be paying in deductibles, what share of doctor's fees you will pay, whether it's a fixed dollar amount or a percentage of the total cost, and what will happen if you are hospitalized. Sometimes, with the lower cost of monthly premiums, there is a higher cost in other sharing expenses. So let's look at some pros and cons of Medicare Advantage or Medicare Part C. The pros of Medicare Advantage are the convenience of one plan, one out-of-pocket limit, and the fact that your plan may include dental, vision, hearing, and wellness. Some cons to Medicare Advantage are a limited network of doctors and hospitals, increased cost sharing, going out of network for coverage, and sometimes plan providers and benefits can change every year. Compare that to original Medicare where you're buying Parts A, B, and D. With original Medicare, you have the flexibility to receive care from any doctor that accepts Medicare. There are no geographic restrictions inside the United States. The downside to original Medicare is that there's no out-of-pocket limit and there's no dental, vision, or hearing coverage included. You have to purchase Part D and Medigap to avoid any gaps in coverage. So let's talk a little bit about what Medigap is and what it covers. Only signing up for Medicare Parts A, B, and D can leave you very exposed to high costs should you become sick and need care, especially the 20% Part B coinsurance for doctor's care. This is the first pitfall that you must avoid as you approach age 65. Medicare supplement plans, also referred to as Medigap plans, are designed to fill the gaps in coverage created by Parts A and B. Medigap supplemental insurance helps reduce out-of-pocket expenses for Parts A and B. There are currently 8 different Medigap plans that are identified by the letters A through N. Plan G is the most comprehensive, but it's also the most expensive. Policies are offered by private insurance companies, and those that have more generous coverage have higher premiums. You can see what each different lettered plan covers in terms of benefits, such as copays, deductibles, and other costs. Plans C and F are no longer an option for those starting their Medicare in 2020 and after. However, even with improved coverages in a Medigap plan, most lack hearing, dental, vision, and long-term care costs, as well as some Part D deductibles and coinsurance amounts. Understanding the types and costs of Medicare can have a meaningful impact on your long-term goals. Let's look at an example. They are 49, making $120,000 a year with a little over $500,000 in assets, and wanting to retire at age 67 on $6,500 a month. You can see when running it through our financial planning software, they came out with an 84% probability of success, something that on the surface we would be comfortable with. Here, with all else being the same, by adding the premium costs of Medicare Part B, D, and Medigap, we see the probability of success is cut to 53%. So why the drop? The reason that we want to include healthcare expenses as part of your long-term plan is because of the way those expenses are paid. Before retirement, most healthcare expenses are paid what we call above the line. This means that you pay those expenses before you receive your net paycheck, and your lifestyle is dependent upon that paycheck after those healthcare costs have been paid for. After retirement, most of those costs are what we call below the line, meaning that you pay those costs such as Medicare and Medigap or Medicare Supplement Part C with income after you receive it. Therefore, these expenses for most clients are not counted in their retirement budgets. And our clients realize not planning for those below-the-line healthcare costs could make their retirement goals less achievable. If you have any more questions or would like a financial plan for you and your family, you can email us at education@thenoblegroup.com, give us a call, or visit our website at thenoblegroup.com. Thanks for watching.